Welcome to the Bloodborne Pathogens Awareness Level Training for non-supervisory level employees. This training will describe what bloodborne pathogens are, why they are dangerous, and what you can do to protect yourself from exposure to bloodborne pathogens. What is a bloodborne pathogen? A pathogen is any type of microorganism, such as a virus, bacteria, bug, germ, or disease, that can be spread from one person to another and make them sick. A bloodborne pathogen is a pathogen found in and spread by contact with human blood or other bodily fluids. Common examples include HIV, the virus that causes AIDS, a serious disease which destroys the immune system, and hepatitis B and hepatitis C, diseases that attack the liver. Infection with a bloodborne pathogen can be serious and sometimes fatal, so it is important to understand how to protect yourself from exposure. How do bloodborne pathogens spread? To understand how to avoid being exposed to a bloodborne pathogen, you first need to understand how they are spread. Bloodborne pathogens are spread when infected blood or bodily fluid gets inside of your body in one way or another. There are many ways infected blood or bodily fluid could get inside of your body, such as through scrapes, nicks, cuts, and abrasions on your skin, getting infected fluids in your eyes, nose, or mouth, or by being stuck by a needle or cut by a blade that has infected fluids on it. Understanding these routes of exposure is an important step to protecting yourself from bloodborne pathogens. The first step to avoiding exposure to bloodborne pathogens is to avoid contact with blood and other bodily fluids. Because you can't look at blood and know whether or not it is infected, you should treat all blood and other bodily fluids as potentially infectious. If it's not yours, assume it's infected and don't touch it. Remember, bloodborne pathogens can be spread by contact with any infected bodily fluids, not just blood. If you come across blood or other bodily fluids in the workplace, let those around you know it's there, then inform your supervisor. Your supervisor will handle cleanup procedures. Non-supervisory level employees are never responsible for cleaning up other people's blood or other bodily fluids. Now let's talk about preventing exposure to bloodborne pathogens by preventing injuries. The best way to prevent exposure to bloodborne pathogens is to avoid spilling blood in the first place. Wear appropriate cut-resistant gloves when handling sharps. Use safety blades in place of regular blades whenever possible. Clean up spills immediately, as slips and falls can cause serious cuts. Don't leave sharp objects lying around or poking out into walkways. This can easily injure someone. If no one gets cut in the first place, we don't have to worry about being exposed to their blood. Look after yourself by looking after others. What should you do if you believe you were exposed to a bloodborne pathogen? If you were, or may have been exposed to a bloodborne pathogen in the workplace, in other words, if you came into contact with someone else's blood or bodily fluid, you must contact HR immediately. HR will ask you some questions about the potential exposure and may ask you to visit the doctor for medical testing. They will also talk to you about the option to receive a hepatitis B vaccine series, which may prevent infection with hepatitis B. It is important to let someone know as soon as possible after a potential exposure. Questions? Please talk to your supervisor or trainer if you have any questions about this training.